Welcome to our webinar tonight, talking about all things GLAD Australia. My name is Caitlin Knock and I'm the GLAD physiotherapist at Allcare Physiotherapy, and I completed my training this year for GLAD. So the first section of tonight will focus on understanding osteoarthritis and its treatment options for you. So let's get started. Okay, so before we begin, I would like to acknowledge the founders of GLAD, Professor Eva Roos and Associate Professor Søren Skau from the University of Southern Denmark. I'd also like to acknowledge the GLAD Canada team for helping establish the English version of GLAD and also GLAD in Australia. GLAD is run as a non-for-profit initiative and is now an international community that receives support from all around the world, with all countries helping each other. In Australia, I would also like to acknowledge La Trobe Uni in Melbourne, their Sports and Exercise Medicine Research Centre and associated staff, along with the many hardworking lecturers and tutors from around Australia who continue to support the quality and development of GLAD in Australia. So, what is the GLAD Australia program? GLAD stands for Good Living with Osteoarthritis from Denmark. It is a program designed for people with knee and or hip osteoarthritis that ensures these people receive evidence-based treatment for their osteoarthritis. The program consists of an individual assessment by a physiotherapist specially trained in GLAD, where you complete some physical outcome measures as well as online questionnaires. There are also 2 education sessions that go for an hour each about osteoarthritis and how to manage it. The main part of GLAD is the exercise sessions, which are 12 supervised neuromuscular exercise sessions over approximately 6 weeks. And this is aimed to improve your joint function and confidence. We then retest your outcome measures that we tested initially with questionnaires and the physical function tests at 3 and 12 months. So you become part of the research for GLAD. So your data is collected before and after the program to continually contribute to research about how GLAD continue to be improved and to help improve funding from the government and private health funds to improve osteoarthritis care in Australia. So this is the osteoarthritis treatment pyramid here. As you can see, first-line treatments at the bottom should be offered to everyone, and all patients with hip and knee osteoarthritis should be offered and complete education, exercise, and weight control interventions before thinking of these second and third tiers, which we will get into a little bit later. The GLAD program provides a way for patients to access the best first-line treatment for hip and knee osteoarthritis. So tonight we will be aiming to improve your understanding of osteoarthritis. We will address what osteoarthritis is, the risk factors for osteoarthritis, the potential treatment options, and their likelihood of helping you, how to exercise with osteoarthritis, and how GLAD will work at Allcare Physiotherapy. So how common is osteoarthritis? More than 2 million Australians have hip or knee osteoarthritis. It is the most common lifestyle disease in people over 65 years in age, and it's more common than high blood pressure and diabetes. It is one of the most common reasons people in Australia see their GP and accounts for more than 1.5 million consultations each year. Persistent hip and knee pain, which is often an early sign of osteoarthritis, can also affect 30% of the population, even younger people. So what is osteoarthritis? It is a lifelong joint disease that can often start without any obvious reason. It affects the whole joint, okay? So there is cartilage on the ends of the bones that changes structure and can thin over time. But the joint capsule, so the capsule around the joint, the ligaments in the joint and on the outside of the joint, and the muscles around the joint, as well as the underlying bone, is also affected. Osteoarthritis is the leading cause of physical inactivity in people over 65 years of age. And as you will discover, that is the worst thing you can do if you do have osteoarthritis, be inactive. Osteoarthritis is often described as a wear and tear disease. This description should be avoided since it leads many people to think that they cannot and should not be physically active. As I said before, this is wrong because cartilage needs moderate and appropriate load through physical activity to actually regenerate itself and keep itself healthy. The focus on the structure of cartilage is also often unhelpful because the causes of the pain that you're getting from your knee and your hip associated with arthritis are often quite complex, and we will discuss a wide range of factors that can affect how your hip and knee pain is affecting you. Routine scans such as X-rays and MRIs are no longer recommended for people with osteoarthritis to diagnose the condition. Instead, it is important to spend time understanding the multiple factors specific to each person, which can affect their pain and disability. We're now going to talk about those factors. So factors that can contribute to pain and disability in people with osteoarthritis are complex. Although structural changes may play a role, there are many other factors, some which are often less obvious, which can contribute to each person's experience with osteoarthritis. So if we look at this map here, we can see that all of these different factors, so you've got your structural changes, which is what people often associate with arthritis, that cartilage change, the joint change, and the images on an X-ray. But you also have your negative beliefs, pain-related fear, lack of confidence, low mood or depression. Social stress and isolation can also affect how you perceive your hip and knee pain. Overload or a history of an injury, muscle weakness, lifestyle factors such as poor sleep and lack of physical activity, and comorbidities such as obesity and fatigue. The good news is that many of these factors can be changed with appropriate guidance and support, which will then have a positive effect on your pain. Unfortunately, there are some factors that can't be changed, but there's no point focusing on these too much because unfortunately we can't change them. So age is a number one factor, and osteoarthritis does become more frequent with increasing age. It is unfortunately an irreversible disease. However, with modifying the previous factors we just looked at, the symptoms that you experience can be reduced and can even disappear. Sex is also a non-modifiable risk factor. Osteoarthritis is often more common in women. Women tend to get osteoarthritis of their hands and knees more than men, and men tend to get hip arthritis more commonly. Family history is another factor that can really affect whether or not you're going to get arthritis. If one or both of your parents have osteoarthritis, the risk of their child having OA as an adult is increased. And the good news is, though, is we can to some extent modify this genetic risk by adopting a healthy lifestyle and looking at those other modifiable factors that we can change. So let's have a look at the anatomy of the knee, anatomy of the hip, joints, and how things change in your joints with arthritis. In a normal joint, the ends of the bones are covered by articular cartilage. The joint is then surrounded by an articular capsule, which produces synovial fluid to lubricate and nourish the cartilage. Ligaments and muscles are in and around the joint to help stabilize the joint. Cartilage itself, on the ends of the bones here, has no blood supply. It needs nourishment from synovial fluid to be healthy and maintain itself. The nourishment from synovial fluid comes through dynamic load, which is cycles of loading and unloading the joint, and this comes from exercise. Cartilage is like a sponge, so if you think of when you put pressure on it, fluid comes out, but when the pressure is released, cartilage sucks the fluid back in. Regular exercise ensures that the cartilage is efficient at sucking that fluid back in. So if you're not loading it up and down, it doesn't get better at sucking the fluid back in at all. The best thing to do is to load the cartilage appropriately, and we're going to talk about that a little bit later. So if we look at the anatomy of the knee joint specifically, the knee joint is a hinge joint between your thigh bone, your femur, and your shin bone, your tibia. It is a hinge joint. You've also got your kneecap, which sits on the top of your thigh bone. There is cartilage that sits on the end of these bones, and in your knee joint, you've also got structures called meniscus, or menisci for plural, which sits on the top of your shin bone to provide cushioning and extra stability to your knee joint. Surrounding the knee joint is your joint capsule. And again, there's synovial fluid in that joint capsule, which helps to nourish the joint cartilage as we just discussed. There are also 4 main ligaments in your knee, your ACL, PCL, LCL, and MCL. and two main muscle groups that attach onto your knee, the quads at the front and the hamstrings at the back, which all contribute to the stability of your knee joint. Now, there are a lot of structures in your knee joint, and it's not always clear which of these structures become sensitized and cause pain when you have knee osteoarthritis. If we look at the hip joint now, your hip is a ball and socket joint. So you've got the ball and your hip socket there. It is between your thigh bone, your femur, and then your pelvis bone. Again, there is cartilage on the ends of the bones, but your hip joint does not have a meniscus. It's got structure called a labrum, which increases the depth in the socket to improve the congruency of the joint. There is also a ligament inside the joint called your ligamentum teres, and also a joint capsule surrounding the joint, again, which contains synovial fluid to help nourish the cartilage of the joint, okay? So what happens in osteoarthritis? Structural changes can occur in your joint. These can include reduced joint space, osteophytes, extra bony formations, cyst formations, and increased density of the bone beneath the cartilage. Structural changes that occur in your joint may be due to cartilage being exposed to too much load all at once, e.g. from a sudden injury. So if you twist on your knee or you land on your hip in an awkward way. It can also occur from too much load over time. So an overuse injury, if you just keep walking and walking or running and running or jumping. But it can also happen from too little load or activity because your tissues aren't getting that stimulus that they need to regenerate and remain strong. It can also happen with a normal load if the cartilage itself is diseased to start with. Okay. Remember, although there are structural changes that occur in osteoarthritis, it's also important to consider those modifiable factors that we might not immediately think about. Like if you had a poor night's sleep, your diet's not great, you need to lose a little bit of weight, your muscles are weak. And these things are things that you're able to take control of and you're able to change. Okay, so signs of osteoarthritis. Osteoarthritis normally starts in one joint. Your symptoms develop slowly, and they may stop completely with certain interventions. Experiences will vary from person to person. Often in the beginning, pain only occurs during weight bearing. Stiffness, especially in the morning or after sitting down for a period of time, is normally short-lived and will only last for about 30 minutes once you start walking around a little bit. As the osteoarthritis progresses, the pain may also occur whilst you're resting and at night time. You can also get red, hot, and swollen joints, which come from inflammation that occurs in your knee. The pain that's associated with osteoarthritis is not from the articular cartilage itself, but comes from the bones, ligaments, and joint capsule, and where tendons can join onto the bone from your muscles. Symptoms can be random and can often vary as well. With your hip, you will often get pain in the outer part of your hip or deep in your groin, and it can be your inner or your outer thigh. Occasionally, pain can be just in the thigh, on the inner thigh, just above the knee. With your knee osteoarthritis, your pain can vary. It can be the front, back, the side, anywhere on your knee. You will often get crunching or clicking, particularly when you're bending down or going up and down stairs. You can start to get a bit of a bow-legged or a knock-kneed deformity, and your knee can start to feel unstable as well after a while. So common problems with hip and knee osteoarthritis that we often see people discussing and sort of saying that they're having trouble doing are putting on socks and shoes, so that bending forward, standing up from a chair, standing or walking for a long time, going up and down stairs, running, completing household activities, gardening, and leisure activities and sport. It's important to work with your physio to develop realistic goals to improve your ability to do the things that you want to do. The GLAD program may help to achieve many of these goals, but there also may be extra things that we need to do to help you to get there. So how is osteoarthritis best diagnosed? So there are two ways to diagnose OA. The first way is an X-ray. However, this is not really recommended anymore. X-rays will often show the same thing as anyone of a similar age and often show reduced joint space, osteophytes, cyst formations, and increased density of the bone beneath the cartilage. It's important to know that the link between changes that you can see on an X-ray and patient symptoms is generally poor. So someone can have an X-ray that by old standards looks terrible, but the patient can actually be symptom-free. So the picture doesn't actually match with what you see in the person in front of you. Patients also can commonly report pain for up to 10 to 15 years before osteoarthritis even shows up on an X-ray. So someone might have signs of osteoarthritis, but not have actually any signs show up on an X-ray. So it's not particularly reliable. X-rays are important when someone's looking down the route of a surgical intervention, like a knee replacement or a hip replacement. But for the purposes of the GLAD program, we just look at the patient clinically. And this is the second and better way to diagnose osteoarthritis. So we look at the patient's symptoms, existing risk factors, and findings from a physiotherapy clinical examination. And it's always the patient's symptoms and not the X-ray changes that guide our choice of treatment. If someone has an X-ray that looks bad, but they have no pain, we're obviously not going to send them for a total knee replacement. So if we come back to the osteoarthritis treatment pyramid to look at what we can do for osteoarthritis, treatment aims at reducing symptoms and improving joint function. And the GLAD program is based off the osteoarthritis treatment pyramid. Every person seeking care for joint pain in their hip or their knee should be offered education, exercise, and weight reduction if needed. This recommendation is supported by Australia's national guidelines for osteoarthritis care. If the first line of treatment, education, exercise, and weight control, doesn't lead to a satisfactory outcome, it could be complemented with these second line treatments. So pain relief, TENS, manual therapy, braces, shoe insoles, other mobility aids, injections, etc. However, it's important to remember that these strategies, these second stage strategies, cannot address the range of factors contributing to pain and disability. So those factors we talked about before, such as muscle strength. The only way to improve muscle strength is exercise. Then we look at the third tier, and for those very severe symptoms, which is about 10 to 15% of the people with osteoarthritis, surgery may be considered. These surgeries include joint replacement, osteotomy, or arthroscopy. So let's look at the first tier of the osteoarthritis treatment pyramid, which should be offered to all patients who have hip and knee osteoarthritis in Australia. This is backed up by the Royal Australian College of General Practitioner guidelines, which state that we strongly recommend offering land-based exercise for all people with knee and hip OA to improve pain and function regardless of their age, structural disease severity, functional status, or pain levels. The problem in Australia, is that this is not currently occurring. The GLAD program provides a way to ensure that all people with hip and knee osteoarthritis receive the first line treatment for OA, which is education, exercise, and weight control. So most people in Australia do not adequately trial the best first treatment for osteoarthritis. So patients will say, oh yeah, I've tried exercise, it didn't work, and they've often only done 2 weeks of it. So they haven't actually given it a chance to work. So the first component of the first line treatment, education, is vital, as it is essential to understand the possible causes of OA, what can be done and how you can change those modifiable factors, and the importance of self-management, because it is a lifelong disease and unfortunately it is irreversible. Exercise is the next component of the first line treatment, and it is proven to be effective for pain relief and has the most positive evidence in all of the literature of any available treatment for hip and knee osteoarthritis. So there are many different factors to exercise. So there are different types of exercise like walking and strength training, which have been found to be effective in relieving pain. Neuromuscular exercise, which looks at the control and coordination of an exercise and how you're doing the exercise, is just as effective for pain. And in addition, targets the arthritic joint to improve stability and trust in the effective joint. During neuromuscular exercise, you will also practice doing things you do every day, like getting down on the floor, getting up again, sitting down, standing up, walking up and down stairs, with good movement quality, and it's teaching your body to load the joint in the best possible way. Now, GLAD uses this neuromuscular exercise, which is what makes the GLAD program unique, because the exercises that you do in the class are relevant and applicable to your everyday life. It's also important to consider, that the dose of exercise matters and that more is better. Weight management is the last component of the first line treatments, and although it can be difficult, it can actually help your symptoms quite a lot. So when you're walking normally, your knee joint is loaded with at least 2 to 3 times your body weight every step you take. Being overweight increases the risk of cartilage and the joint becoming overloaded. And a relatively small reduction in your weight can actually have a big effect on joint load. So approximately for every kilo that you lose, the load is reduced by at least 2 to 3 times. It is important that you look at your diet and exercise and use them both to reduce your weight, because your general health will also improve if you have a better diet and you're more active. So if we now look at the second line treatments, you just have to remember that these should not replace the first line treatments of education, exercise, and weight control. So these second level treatments have varying levels of evidence, which we are now going to talk through. Often they are associated with benefits in terms of reducing pain, but this is often only in the short term and should, as I said, not replace the first line treatments of education, exercise, and weight management. So the first part of second line treatments can include additional treatment as guided by a physio. So we provide these here at Allcare Physiotherapy in conjunction with our first line treatments. So some things that physios can provide are shoe inserts, orthotics, we can tape, and we can use braces, which can help to reduce your pain and improve your confidence. However, this is often only in the short term. Sometimes these are good because they facilitate you being able to actually complete exercise because they reduce your pain enough. Dry needling or acupuncture and manual therapy can also help reduce your pain in the short term. So can using a walking stick or a cane in the opposite hand just to decrease a little bit of the load on the joint. Additionally, hot and cold packs and TENS machines with electrical stimulation can also help to reduce pain. They're easy to use at home. And again, as I said, they can lower your pain level enough so that you are able to participate in the exercise more effectively. As I said, these treatments should never be used in place of first-line treatments, which is the education, exercise, and weight management, and they should be used in conjunction with the first-line treatments. So if we now have a talk about pain medications, which is another second-line treatment, and often we do see a lot of patients with osteoarthritis, on these medications. And again, they should be used in addition to the first-line medications. So paracetamol or Panadol is a weak painkiller. It has few side effects and it can help in the short term. However, studies have shown that there's no long-term benefit to regular use in comparison to placebo, so a fake tablet. Non-steroidal anti-inflammatories, so your Nurofen, Voltaren, or your Advil, they're estimated to be 3 times more effective for pain relief compared to paracetamol. However, they are often associated with greater risks, including stomach ulcers, and people with other chronic diseases like heart disease should not take these. It's important to remember to always talk to your doctor about what pain medications might be appropriate for you if you have osteoarthritis. If we then look at a different type of medication, opioids, these have a morphine-like effect and they are very strong painkillers. There is no evidence that opioids like endone will help pain that's coming from hip or knee osteoarthritis. In fact, they may even make pain worse in the long term, and some research indicates that 1 in 150 people who regularly take opioids will die of an overdose. Guidelines for osteoarthritis around the world recommend against taking opioids, in fact. So if you are taking opioids for your hip or knee osteoarthritis pain, you may wish to speak to your doctor about strategies to reducing your dose. We have a look at another element of the second stage interventions. We're looking at injections now. So corticosteroid injections are very common in Australia. It is not uncommon for someone to completely bypass first-line treatments though and go straight to a cortisone injection. So we need to make sure people are still receiving education, exercise, and weight management in conjunction with a corticosteroid injection. There is evidence to suggest that they can be helpful for a short-term symptom pain relief, And as I said, then enables people to do exercise and get the most out of their exercise program, and can be helpful when a rapid reduction in symptoms is required, particularly if you've got an acute exacerbation, you accidentally twisted or you lifted something and you did more than you were used to, you now need to settle it down. It is important to remember, though, that because it is an invasive procedure, adverse events such as joint infections can occur. And if you keep getting repeated cortisone injections, so more than 8 over the course of 2 years, can actually lead to cartilage loss, which is not what we're aiming for in arthritis. Other common injections which we see are often the Syn Risk injection, and this is an artificial fluid proposed to replace joint fluid. There is some evidence of short-term benefit, and again, the risks can include joint infection or inflamed joints, which occurs 1 to 3% of the time. Platelet-rich plasma is another injection that is proposed to increase the concentration of growth factors in your joint, which uses your own blood, which is then processed and then put back into the joint. There is some evidence, again, that this helps pain in the short term for up to 12 months, but it's still not conclusive yet. So that's the last of the second line injections. And as I said, second line treatments, and they should be used in conjunction with the first line treatment. So we now look at surgery as the last resort, and about 10 to 15% of people with hip and knee osteoarthritis should be considered for surgery, and only after they've tried the first line and maybe used a few second line treatments as well. And if that's still not working for them, then we need to look at a surgical option. So the first type of surgery that someone can undergo is an arthroscopy. So hip and knee arthroscopies are very common procedures. They're often known as keyhole surgeries, and you tend to just go in there to have a bit of a cleanup of your joint. And they are associated with about a 30% reduction in pain afterwards. However, arthroscopy surgery is no more effective than a placebo or a fake surgery in multiple studies of people with knee pain. Studies have shown that fake surgery is also associated with around a 30% pain reduction in people who are 35 years and older. This means that any benefits from the actual surgery are likely due to factors not actually related to the procedure or the cleanup itself, and could be due to the post-surgical rehab and the exercises that they're doing, better management of load because the patients had a little bit of rest and time off their feet. They're less scared of exercise because they think their knee is better, and any other number of factors. It's also important to remember that each surgical procedure has risks that must be considered, including infection. So in the knee, guidelines all around the world actually recommend that arthroscopy should not be performed for people with knee osteoarthritis. And in the hip, there is much less guidance at this point in time. Because of this lack of guidance, Medicare doesn't actually currently fund this procedure for the hip in osteoarthritic patients. The other type of surgery that commonly occurs for hip or knee osteoarthritis is joint replacement surgery. So this is where joint surfaces, of your hip and knee joints are replaced with artificial joint surfaces made from metal or plastic. So joint replacement surgery is often done in people with severe osteoarthritis, as I said, who have trialed the first and second line treatments, but it's not sufficient enough and they're still not able to do what they want to do. Joint replacement surgery should not be offered or provided to people who have not adequately trialed first-line treatments like exercise, education, and weight management. So people who complete GLAD can often delay surgery if they are down on the waiting list and sort of looking down that route. 66% will delay for at least 2 years after completing the GLAD program. So if you want to try the GLAD program first before you do the surgery, that is always a good idea. You may end up delaying surgery, and if you don't, you're still getting the benefits from having done exercise beforehand to improve your recovery after you have the operation. And although most people benefit from total hip and total knee replacements, it's important to remember that they're not always 100% successful. About 80% of knee replacements are successful in terms of reducing pain and improving function, and 95% of hip replacements are beneficial. It's also important to remember, that with all surgeries, there are risks and potential complications. And once you actually have the surgery, you also have to do rehabilitation exercises anyway. As I said before, doing a program like GLAD with the exercise, even if you are thinking of having a surgery, is important because you are in a better position after the surgery to recover well. So we're just going to have a little break now and a little breather. And I'm going to grab some water, and then we're going to get started on the second part of the talk, where we look at exercising with arthritis, managing arthritis, and how GLAD's going to look at all care physiotherapy. So just give yourself 2 seconds. I'm just going to have a bit of water, and then we'll see you in a minute. Okay, so let's get started on part 2. Okay, so this part, as I said before, we're going to talk about exercising with arthritis, self-management of arthritis, and how GLAD will look at all care physiotherapy. So what actually is exercise? So we can think of there as being 2 types of exercise. We've got physical activity and therapeutic exercise. Physical activity is considered to be the general exercise that's good for everyone. It can occur in your everyday life. So during leisure activities, when you're walking, playing sport, or when you're at your job or going to your job. You might not always have control of the load that your body undergoes whilst you're at work or during leisure activities, and this can contribute to increased pain. For example, if you're at work and you have to carry a box that's heavier than you can handle, or walking faster and trying to keep up with a group of walkers who are your friends. It's important to continue to be active, particularly to help manage your osteoarthritis, and it is possible to improve your capacity to complete physical activity with therapeutic exercise. So think of it as the bigger picture. Therapeutic exercise focuses in on the things that you need to work on to make yourself be able to do more physical activity. Therapeutic exercise is carried out with a specific purpose. It can be guided by a health professional and can improve your ability to be physically active in work and leisure time. Therapeutic exercise can be designed to work on many things to help people with osteoarthritis and make it easier for you to participate in general physical activity. So there are many things that we can look at in terms of how to train a muscle and how to train a joint to make it easier for you to do everyday activities, leisure activities, and occupational activities. So neuromuscular exercise is the main type of exercise that's focused on in GLAD. It's exercise that focuses on joint control in functional or everyday positions. Neuromuscular exercise can improve the way you move and give you more confidence to do other exercise as well. In GLAD, exercises are also completed to improve your muscle endurance and strength, along with your ability to perform common functions well, so functional exercise, like sitting up, sitting down, and standing up, and walking up and down stairs. Exercises can also look at muscle power, which is how your muscles use strength quickly, which may improve your balance and also improve your ability to do exercises that require power, such as running or walking quickly. And exercises to improve your flexibility may also help improve your joint movement. Aerobic exercise is another type of therapeutic exercise, and it may help to improve your physical fitness and your general health, which will help to assist you to get back to many recreational physical activities. So we now go to the next slide. Why do we need to be physically active? So being inactive increases our risk of at least 35 chronic diseases. Exercise and physical activity needs to be thought of as medicine. Exercise and being active can help prevent and treat many other chronic diseases, such as cardiovascular and heart disease, diabetes, dementia, and certain cancers. And there are many positive effects from being physically active, including lower blood pressure, lower blood cholesterol, more controlled blood sugar, increased physical fitness, stronger muscles, stronger bones, better cartilage health, because cartilage requires dynamic load to regenerate itself, Lower body weight, increased appetite, or increased body weight if that's necessary. Increased endorphin release, which results in less pain and better mood as well. So it's also really good for your mental health. So if we look at the physical activity recommendations, guidelines in Australia recommend at least 150 minutes of moderate or 75 minutes of vigorous physical activity per week. You will receive further benefits if you do more than this as well. A simple aim should be to complete 30 minutes of exercise every day. And importantly, the exercise should be completed in bouts or sort of lots of at least 10 minutes at a time. At least twice a week, These exercise bouts should be 20 minutes or longer and either maintain or increase intensity throughout this. Exercise should be completed at an intensity when you start sweating and become slightly short of breath. This means endorphins or a natural high will be released and you will start the adaptation process to getting stronger and fitter. So if at the moment you think that exercising for 30 minutes a day seems a little way off and a little bit difficult, it may be helpful to set a smaller initial goal. So even if you're just walking for 10 minutes a day, because if that's all you can do for the moment, that's better than nothing. You can always gradually build up and at least you're moving. Keep it up. Other things that you can do to stay active in addition to walking and physio exercises can include any sort of sport, walking, running, as we've discussed, cycling, swimming, aqua aerobics, hydrotherapy, dancing, land aerobics, strength training, anything, okay? Anything that you enjoy and that you're going to do is the best form of exercise for you. Your body needs to move, so find something you love to do and do it. Now, coming back to GLAD and how this fits into all of our exercise talk, remember the Australian Clinical Practice Guidelines published by the Royal Australian College of GPs recommends that all Australians seeking care for osteoarthritis should be offered exercise. But why is exercise so important for osteoarthritis as well as the general public? So as we talked about before, your cartilage needs to be loaded appropriately so that it can regenerate itself. Your cartilage and your synovial fluid, is only stimulated with dynamic load, okay? So movement and loading stimulates the new development of cartilage, which improves its shock absorbing capacity. This then improves your joint range of motion, stability, and function, which helps you to move better and improves your confidence in your joint. But how are you supposed to exercise with arthritis? Exercising with arthritis should include strength training, neuromuscular training, and functional training, which is all included in the GLAD program. Having strong muscles helps to stabilize your joint and improve your confidence to complete activities you need to or you want to. Using the right muscles at the right time with appropriate force is really important, and this is practiced in the GLAD program. This makes it easier to control your movements and complete functional tasks. But remember, it's also important to rest and recover appropriately so that your body can recover and rebuild itself between your exercise sessions. This is why in GLAD, the exercise classes are spread out over the week, happening twice a week with rest days in between. So neuromuscular exercise, as I talked about before, is a main focus of the GLAD program. It improves joint control, which can help reduce pain and increase confidence in your joint. So when we're looking at the exercises that you're completing in GLAD, we're looking that your hip, your knee, and your foot are all aligned nicely when you exercise. Control, quality, and concentration are required for neuromuscular exercise so that you can load your joint more evenly, more appropriately, and you're getting the best out of it. Ideally, your knee should not fall inward or outward when you sit down or stand up or complete other activities such as squats or lunges. And your physiotherapist, so myself, will direct you as to what is right for you to do. A neuromuscular approach to exercise is effective at reducing pain and improving confidence in most people with osteoarthritis, even in people who are about to have a joint replacement. So the evidence for this type of exercise is very good. We can then down the track look at adding load or more weights to increase your strength with your good neuromuscular control with the exercise. So how much exercise should you be doing? So as I said before, your exercise needs to be adequately dosed to help. So you should be completing a minimum of 2 sessions, but if you can complete 3 or 4 per week, you will get better outcomes. You must try a strengthening exercise program for 6 weeks minimum to see any effect of the exercise program on your strength, your function, and your everyday life. So remember, the best exercise though is exercise that gets done. So even if you, as I said, 10 minutes of walking is your minimum. If that means you've done 70 minutes of walking a week, which is more than 60 hours a year. And even at a slow speed, this equates to even more than 200 kilometers a year, which is absolutely better than nothing. Like I said before, it's important to load the cartilage, load the joint, load you appropriately. So you don't want to do too much too soon. This is important in programs like GLAD and any other exercise that you might choose to do. So you need to learn the correct amount of load for you, and that is very variable. And sometimes you might get it right, sometimes you might get it wrong. The right amount of load will help you get stronger and improve the health of your cartilage. And each person needs to learn that load. As I said, it's very individual and you need to learn what's right for you. As you do more, you can gradually increase how much more you do. But if you have a rest, for example, if you're sick or you go on a holiday, you need to go back down again and start to build up again from there. With arthritis, it's important to remember too when you're exercising that pain doesn't mean that you're doing damage to your knee. Pain is unfortunately a companion to arthritis, and it does often hurt when you start exercising. But this is just because it's a novel thing for your body and your body needs to get used to it. It is okay if you are getting pain when you exercise up until a certain limit. But we need to try and sort of monitor this carefully. In GLAD, we use this scale here, 0 to 10, and we accept about a 5 whilst you're exercising. So we have to remember that pain during exercise must be perceived as acceptable because humans are hardwired to treat pain as a warning signal. But you shouldn't let it prevent you from exercising. Any increase in pain that occurs during exercise or happens after exercise around this 5 out of 10 level should stop or go back down to normal level within 24 hours. That's how you know that you've hit the right load for you. Around a maximum 5 out of 10 and should go down to your pre or normal exercise level within 24 hours after completing the exercise. And in GLAD, we really pay attention to how much pain you're getting during the exercise, how you're feeling after the exercise, and how you recover in the 24 hours after the exercise is completed. So exercise is vital for people with osteoarthritis. As I said before, pain doesn't equal damage, and it actually takes a lot to damage your joints and muscles. Excessive inactivity is often worse than inactivity because you're not getting that loading of your cartilage, and the cartilage is not getting that nourishment that it needs from the synovial fluid. It's important to remember that you don't get more osteoarthritis by being physically active. If anything, it helps because you're regenerating your cartilage and the cartilage is nice and healthy from the loading. And being active doesn't just help osteoarthritis, it helps prevent more than 35 other chronic diseases, including depression, cardiovascular disease, heart disease, diabetes, and falls. And it's important to also remember that activity can actually divert your attention from the pain. So, you might be distracted playing a game or doing an exercise that you find challenging or an activity that you enjoy, such as dancing. And that can then encourage you to keep going with the activity. And then you realize, oh, that was actually good. And it's doing you a world of good as well. So there are many strategies that you can use to stay active, and you can talk to your physio about this as well as to how to manage and help moderate your load. So this includes using supportive devices, taking breaks more often, dividing the activity into smaller parts. So instead of walking 3 kilometers in one go, you walk in 1 kilometer chunks with rests. You can find other ways of doing a similar exercise, lowering demands, and getting help and support from others. As I said too, your physiotherapist can help you work out what's best for you to ensure that you stay active. So now we're going to talk about GLAD at All Care Physiotherapy. So first you will come for an initial assessment with myself, and this goes for an hour. We're going to look at your hip or your knee to determine clinically whether or not you have arthritis and would benefit from participate in the program. Once we've decided that you are suitable, we'll then assess 2 physical function tests: your chair stand test, so how many times you can stand up and sit down in 30 seconds, and a 40-meter walk test, so how fast you can walk 40 meters. These will be used to assess your progress once you've completed the program. We also provide these results to La Trobe University if you agree to participate, as you are forming part of the growing research to help provide evidence for the GLAD program. It's really important that if you agree that you complete your questionnaires so that the program can continue to be improved, and then we can improve funding from the government and private health funds, to improve osteoarthritis care in Australia. In the first session too, we also run through the exercises that are included in the exercise class so that you are familiar with them before you come to your first class. After that, you're then ready to start your GLAD program. So the GLAD program itself consists of 2 one-hour education sessions and 12 one-hour supervised group exercise sessions over 6 weeks. So that's 2 one-hour sessions every week for 6 weeks. But that is all you have to do. You're not expected to do any more exercise apart from those throughout the time. If you want to, you can, but that is the minimum required exercise that you need to do. Once you've completed the program, after 3 months, you will have a reassessment where we look at your chair stand test again, so how many times you can stand up and sit down, and a 40-meter walk test. And we can compare how you were from the start with how you are now. You also will get another questionnaire at 3 months and then a questionnaire at 12 months. And we asked again to do those because you're contributing to the research for GLAD. At Allcare Physiotherapy too, we give you a GLAD exercise equipment pack, which includes a TheraBand, exercise slider, and a Swiss ball. And this allows you to continue your exercises as part of the GLAD program once the program is finished, because you should be then empowered and have the knowledge and skills to continue the exercises and self-manage your osteoarthritis down the track. So in each exercise class, there's a 10-minute warm-up, 2 core stability exercises, 2 joint alignment exercises, 4 leg strength exercises, 2 functional strength training exercises, and then a cool down and some stretching. Our classes have a maximum of 6 people, and so it's 1 to 6 at least. And your physiotherapist will guide you in terms of what progression of each exercise is right for you. There are many different levels and different things we can add to the exercises to make them appropriate and safe for you. So at Allcare Physiotherapy, the initial consultation is per normal physiotherapy charge. Then the GLAD program, you're getting a pack. So you get the 12 exercise sessions that go for an hour, 2 education sessions, your 3-month reassessment, and the exercise equipment pack for $700. All of the exercise sessions, and the physio assessment sessions are able to be claimed on private health. So you minus your rebates off that again. So you think you are getting good value because you are saving some money if you add all of this together. And if you think about overall, $700 is much less than a few $1,000s for an operation. So why should you do GLAD? So just a refresher, GLAD includes the 2 education sessions, the 12 exercise sessions, and retesting before and after of your outcome measures to see how you physically perform and your quality of life at 3 and 12 months. It's a way to ensure that you receive the best evidence-based first-line treatment for hip and knee osteoarthritis, and teaches you how you can manage your arthritis for the long term whilst avoiding or delaying surgery. So if we revisit this treatment pyramid again, we can see that GLAD provides a way for people with hip and knee osteoarthritis to receive the best first-line treatment of education, exercise, and weight management strategies, which is the recommended and proven first-line treatment for hip and knee osteoarthritis. So there are a variety of second and third-line treatments that can be offered to people if first-line treatment doesn't work. However, only about 10 to 15% of people really need to end up at this third line of surgery. So GLAD is the best first treatment for hip and knee osteoarthritis. It provides a standardized program for patients to follow, and every patient with arthritis should trial a minimum of 12 exercise sessions over 6 weeks before looking at these extensive stage 2 and 3 interventions. So studies have been completed about the efficacy of GLAD, particularly in Denmark, where this program originated, and they found that there are many benefits associated with completing GLAD, including improved joint confidence, reduced pain, improved quality of life, decrease in how many pain medications patients have taken. They've taken less sick days. They're less likely to feel the need for surgery. They're more likely to delay surgery. And even if you do have surgery, it's great prehabilitation. So it's great to do beforehand to make your recovery better down the track. So now what to do? Our first GLAD program block at All Care Physiotherapy begins on Tuesday, the 1st of June this year. Please just contact our friendly admin team on 3112-7700 or email them here to book in for your initial assessment with me and get started on your journey to manage your osteoarthritis. If you'd like any further resources, you can look at the GLAD Australia website here, as well as the guidelines for the Royal Australian College of GPs. So thank you for tuning into this evening. That's all we have time for this afternoon. If anyone has any questions, please comment them on the Facebook or in the chat, and I will reply to them shortly. Thank you.